Good morning. My name is Mackenzie Green, and I will be sharing with you what I've learned over the past 5 weeks in the Healthcare Terminology course at Colorado Christian University. First, I'll give you a quick introduction of the things that I will be covering over this presentation. In Week 1, we discussed common mistakes in the healthcare field, specifically relating to healthcare terminology. In Week 2, I had the opportunity to reflect on my own personality in both my strengths and my weaknesses and what I can bring to the table in a healthcare scenario. In Week 3, we were presented with a medical scenario and given options about what we might do in the situation. In Week 4, I had the opportunity to interview a colleague of mine and learn a little bit more about his profession. Now I'll dive deeper into Week 1 and common mistakes. It is natural for people to make mistakes. There's no way around the fact that we are human and we will make mistakes. However, there are ways to prevent these mistakes. It's important that employees report their mistakes so that companies have a better idea of how to handle these things. Some risks of reporting a medication error may be that the employee receives counseling or coaching. They may get a write-up or have any sort of employee discipline, such as a suspension or maybe even a demotion. Or they may just feel embarrassed and have a mark on their reputation. However, there are many benefits to reporting a med error, especially for the company. The managers in the company itself may be able to anticipate further mistakes by knowing when mistakes or potential mistakes happen. They may be able to understand causes of mistakes better so that they can provide education and training for staff so that these medication errors can be prevented. A quote I found in my research states, "Errors are best corrected when real and potential errors are reported, documented, and evaluated to minimize harm to patients. Even if a mistake doesn't occur, you can have a near miss. It's important to report these things so that your company, your organization, and your managers have the opportunity to understand why. Are you dealing with stress? Are you overworked? Do you have too many patients in your care? These things can all be prevented, so it's important to be honest and report those mistakes." In Week 2, I had the opportunity to reflect on my own personality. Some of the strengths that I feel that I bring to the table are empathy. Empathy is a natural trait for me. It's always come naturally to me to be able to feel other people's feelings and to be able to identify with what they're going through. A learned skill that I have honed over the years is composure. It's easy to get stressed out during a healthcare emergency or any sort of medical scenario when lives are on the line. However, over the past 10 years, I've had the opportunity to learn to have composure, to be calm in an emergency, and to make sure that I keep my own feelings under control so that I can best take care of my patients. Lastly, I have the strength of connection. I feel that I'm able to provide reassurance and comfort to my patients. That goes along with empathy and the fact that I can feel what they're feeling so that I can identify with them and tell them, I'm here to help you. Some of the weaknesses that I reflected on during Week 2 are that I'm non-confrontational. I don't like arguments. I don't like telling people when I think that they're wrong. So sometimes that weakness makes me just let things happen instead of standing up for myself or standing up for others. Another weakness that I have is low self-esteem. From the time I started working in healthcare at age 18, I've always been convinced that I'm the least qualified or the least intelligent in my job. No matter how much training and experience I have, I still think that I must be the least intelligent in my job. This is a difficult weakness to have. Instead of embracing the strengths that I do have, occasionally I let low self-esteem take over and think that I must not be very good at what I do. Johnson says in their 2020 article, "A lack of assertiveness is one of the common effects of a lower self-esteem. This can turn into a vicious cycle in which low self-esteem leads a person to accept more work than he or she can truly handle. This is a true thing. In my case, I tend to be a yes person. If someone asks for help, of course I'm going to help them. However, I don't like to say no. Sometimes I find myself saying yes to too many tasks, and then suddenly I need help because I have too many things on my plate." In week 3, we were presented with a medical scenario. We were prompted to imagine that we were a nurse in a busy healthcare scenario. We were told that we gave an opioid before the end of our shift, but that we forgot to document it. The next day, we found out that our patient had arrested overnight due to our lack of documentation, and a nurse gave another opioid because we didn't document what we had given. We were asked, what would we do in this scenario? This is a really difficult one. Should I report my medication error or call it a close call and move on? Since nobody reported me and it was certain that I wasn't going to be reported, should I still report myself? Of course, we know the right answer is that we need to report ourselves. However, this is a really tough one. I know that I should report myself, but my feelings say, no, you don't need to report yourself. It will be fine. However, in a scenario like this, potentially reporting myself could bring about good things, such as my manager recognizing that I had too much on my plate, or that I was mandated too long and I was exhausted and forgot to do what was important. So reporting medication errors is always, always important. In the Bible, Philippians 2:3 states, "Do nothing from selfish ambition or conceit, but in humility count others more significant than yourselves." I found that this verse really spoke to the medical scenario that we discussed. My selfish self and my own conceit would make me say, oh, I don't need to report it. I don't want to ruin my reputation. However, if I had humility and decided to count others as more significant than myself, potentially I could prevent further mistakes for my own coworkers. In week 4, I had the opportunity to interview my dear friend and colleague, Phil Meisty. He is a paramedic in the Grand Rapids area, and he works hard to save people in emergencies. A few things that I learned in my interview from Phil Meisty were that it's important to keep up on continuing education, especially in the field of emergency medical services. Standards are changing all the time. New protocols are being written, and it's important for paramedics to keep up on their continuing education. It's also important to take the time to ensure accuracy in patient care, especially in emergency situations. There are lots of things going on, and it can be easy to forget to take the time to double check a medication or to double check a dose, and it's easy to make mistakes. The last thing that I learned from Phil was that it's important to be a lifelong learner. Again, things change so drastically and so quickly in emergency medical services. It's important to always be ready to learn and change how you do things to make sure that your patients get the best care that they can get. Thank you for listening, and I hope that you recognize from this that medical terminology is essential. You can take a look at my references here, but I thank you for listening, and I hope you have a great day.